Hello, welcome to Integrated Wellness Live Chats. I'm Courtney.
Hi, I'm April.
And we are going to be talking to you about endometriosis today. So before we get started, I always like to explain our clinic. And if you've never tuned in before to any of our live chats, we are an integrated wellness centre. We're here in Mooloolaba today, but we have clinics in Caloundra. This always tests my memory. Caloundra, the Gold Coast, Brisbane. We have a range of practitioners, from us naturopaths, some of us are nutritionists also, integrative GPs, counsellors, psychologists, and for fairly recently an acupuncturist has joined our team, which we're so excited about. Okay, so what if there was a listener out there today, April, if they're not sure of or have just been diagnosed with endometriosis? Can you give us a bit of an explanation on what that is?
So simply, endometriosis is when you've got normal tissue that's usually found inside your uterus, starts growing outside of that, but within the abdominal cavity. So what happens when that tissue is growing outside of where it should be, it can start growing on the outside of your intestines or your ovaries, and it responds to the hormones just as the same as what it does inside the uterine cavity. So that can start to bleed. That bleeding has nowhere to escape from the body, and that whole situation can cause a lot of inflammation and pain within that area, within the abdominal area, especially during that time of the month when you're having your period.
Yeah, okay. Interesting. I've had a couple of clients myself with either the history of endometriosis or a new diagnosis. As you may already know, with us naturopaths, we're not actually that passionate about a label or diagnosis. Certainly this information can be helpful to help identify and target the treatment that we offer, but being naturopaths and being holistic, we're going to look at you as an individual. We're going to take any label that you do have, listen very, very carefully to your history, your symptoms, and look at your entire lifestyle, diet and environment to assess and educate you on the things that may or may not be contributing to your symptom set. So based on that, April, what are some of the things that you've looked at, or what are some of the approaches you've used with some of your clients?
So with endometriosis, like you touched on, hormonal imbalances often plays a real big role, especially women that tend to be more of that estrogen dominant. So with estrogen dominance, usually you're going to be getting those heavy periods, those lot of clotting, cramping, pain. So if a woman has high estrogen but also has that endometriosis, that tissue, once again outside the uterus, is going to be responsive to those hormones. So we want to check, and we can do saliva testing where we check and see what the estrogen levels are. By helping bring estrogen back into a good range, we can then help with the sort of symptoms that you would see. Also as well, when we're looking at hormone balancing, once again, we also look at how is their gut functioning, how is their liver functioning. So we want to make sure both of those organs are working well in order to process those hormones and get rid of them out of the body. Like I touched on before, pain and inflammation are two major things in endometriosis, and that's like the indicator that you could possibly see that you've got an issue in that area. So we want to be looking at dealing symptomatically with reducing that inflammation, which in turn reduces that pain. So looking at things that are going to bring down inflammation, like looking at your diet. Especially like reducing things that promote inflammation, like alcohol, your inflammatory foods, like your high refined sugary diet. All of that really actually can be contributing to an issue that's already there.
And I think that's important to look at diet and what could be coming in, contributing to inflammation. I think the outside environment as well can be just as stressful or as inflammatory. And I think a lot of patients I've had, and I know that you would have as well, we can often and do need to look at your stress hormones and adrenal hormones because of the role they play. There's an axis, a hypothalamic pituitary axis that these hormones sit upon, and one does not have an isolated effect without affecting the other. So the adrenal hormones and the female's hormones of the body interrelate. The thyroid also can play a role here. So depending on that patient, and when you talk to them and sit them down and get their history, you're going to have a really good idea of how much information we want to look at for those hormones to make sure that they're getting the best treatment possible, and that we can educate around if there is a lot of stress going on, we're going to focus more on self-care with that patient and looking at those things. Awesome. So would there be any other indications or anything that you've seen, what we say in the industry, that comorbidities or things that you also see alongside endometriosis, or what are some of the things endometriosis can affect outside that spectrum of hormones?
Yeah, I mean, like you mentioned before, obviously stress and anxiety, any factors that are contributing to that. I mean, generally with endometriosis, or anything that causes a lot of inflammation, it definitely can cause other issues when you're looking at hormones. So infertility. Yeah. So if someone's really struggling to fall pregnant, we could have a look and say, hey, has there been a case of endometriosis that hasn't been addressed? Yeah, that's probably one of the main ones that I can think of. Yeah,
and I think that often when you've already talked about the inflammation, where else is there inflammation? Is the gut absorbing? Is there a nutrient deficiency we've overlooked? If there's heavy bleeding, is there an iron deficiency we need to get on top of? And that naturopathic aspect and approach is holistic in that when we do sit down with our patients and look at you in your entirety, we'll be addressing all of those factors that may be contributing to the thing you walked in with, and we might be uncovering and discovering things in your journey that were overlooked, and that can get you feeling much, much better and much happier much sooner. Awesome. Well, that was great. Thanks, April, for coming and chatting to us about endometriosis. If you have any questions or queries, or you have some topic suggestions, please hit up our webpage or comment below, and we look forward to talking with you next time. Thanks. Take care.